Welcome back to Infection Prevention and Control on Animal Farms. This training is being presented by the Northwest Center for Occupational Health and Safety Continuing Education Programs at the University of Washington, the Center for One Health Research at the University of Washington, and Harborview Medical Center. In Module 5, we will be discussing infectious disease emergency response and the need for an emergency response plan in addition to your IPC plan. In this module, we will examine possible types of disasters and emergencies related to infectious agents that could occur on animal farms, become familiar with the basics of disaster planning and emergency management and how it relates to agriculture, discuss how infection prevention and control in a One Health approach can be integrated into animal farm disaster and emergency response plans, and briefly discuss the mental health toll on workers involved in emergency response, including compassion fatigue. Once you complete this module, we expect you to be able to discuss different types of infectious disease emergencies that could occur on animal farms, identify emergency management resources that will help you protect worker health and safety in an infectious disease emergency, describe the purpose and impact of a One Health whole community approach to emergency management and planning, and explain systems used to manage disasters and how an IPC program for your farm can play a role in protecting the health of workers who are responding to an emergency. In spite of our best efforts to prevent and control the spread of infectious disease among animals and workers on the farm, we cannot eliminate the possibility of infectious disease outbreaks that may become emergencies. These emergencies can be triggered by several sources: infectious agents originating on the farm, infectious agents from a foreign source, or other natural or technological disasters that result in an increased risk of infectious disease transmission. The most likely infectious disease emergency that could occur on a farm is simply an outbreak of disease among animals in spite of efforts to prevent disease. When any farm has an outbreak, there is a risk of spread to other farms. An outbreak of avian flu on a turkey farm in Iowa in 2015 led to the worst animal disease event in U.S. history. Agriculture has been identified by the U.S. government as critical infrastructure and vulnerable to terrorism, including the contamination of animal food and water supplies. Foreign animal diseases are diseases that have either never been found in the U.S. or have been eradicated. Animals are susceptible to these diseases, which can be brought in by imported animals, animal products, feed, or crops. The U.S. Department of Agriculture oversees animal health emergency management and has developed a foreign animal disease preparedness and response plan. Their website is a valuable resource for information about specific disease response procedures and overarching strategies to deal with foreign animal diseases in general. There are also many potential disasters that are not caused by infectious diseases, but that can lead to an infectious disease emergency due to possible impacts on infrastructure required for sanitary conditions on the farm. Infectious disease outbreaks on farms can become public health emergencies if there is a potential to affect the food supply or to spread to the larger community. The response to any public health emergency will involve government agencies, and additional workers and/or contractors may become involved. When an infectious disease outbreak on a farm becomes a public health emergency, the government response will be guided by the National Incident Management System, or NIMS. This is a system developed by FEMA that allows government agencies, non-governmental organizations, and the private sector vocabulary, systems, and processes to work together to prevent, protect against, mitigate, respond to, and recover from incidents. FEMA recommends and supports preparedness that uses a whole community approach such that residents, emergency responders, organizations, and government agencies can collectively address the needs of communities. This whole community approach recommended by FEMA is consistent with the One Health model that we have described, in which farm workers, government officials, veterinarians, healthcare providers, and public health agencies work together to manage infectious disease emergencies. The U.S. Department of Agriculture has developed an online reporting system for reporting investigations of foreign animal diseases, surveillance and control programs, state-specific disease outbreaks, and national animal health emergency responses. Follow the link on this slide or in the Module 5 resource list to learn more about and start using EMRS2. During emergency response activities, it is extremely important for farm management to focus their efforts primarily on protecting the health and safety of farm workers. There can be major challenges associated with maintaining a safe and healthy workforce in an emergency. There may be communication barriers associated with language. There may be challenges associated with stress and compassion fatigue among workers who are required to manage depopulation activities or animal disease and death. There can be supply issues leading to shortages of PPE, and workers may have been inadequately trained to carry out their emergency response activities safely. Because of these additional challenges, and because an emergency response on a farm will involve different procedures than the preventive measures that are in your IPC plan, it is equally important for farms to have emergency response plans that lay out how they will protect their workers while they work with government agencies and other stakeholders involved in the response. Local emergency planning committees are community organizations that assist in planning for emergencies. They are comprised of stakeholders from various community services and organizations, including elected officials, police, fire, and public health departments, environmental agencies and transportation departments, community groups, and the media. Your LEPC will want to be involved in the development of your emergency response plan, since they may be expected to assist in response activities, and because they can maintain information about emergency plans across the community for an integrated response. Although your emergency response plan will be distinct from your IPC plan, the procedures that you have developed and implemented for infection prevention and control can be incorporated into your emergency plan. If your workers are trained and immunized and you have personal protective equipment stockpiled and available, a compliant respiratory protection program already in place, and a designated healthcare provider familiar with your operations and your plan, you will be much more prepared for responding safely to an emergency situation. Your IPC plan is designed for daily operations on the farm. When there is an emergency, you will incorporate many of the procedures in your plan to protect workers in your response, but this may not be sufficient. Additional actions must include: if there is a quarantine order, the farm must create restricted areas for sick animals and identifying these areas with signs notifying workers of potential exposures. Workers must be provided with special protection when entering restricted areas where animals are quarantined, including additional PPE if appropriate. Workers involved in culling, killing, or disposing of dead animals should also be provided with special protection and training. And workers involved in disinfection or fumigation operations must be adequately protected from chemical exposures. There are guidelines available from several agencies for the additional protection required for workers in specific scenarios. For example, there is guidance from the CDC for swine influenza outbreaks, guidance from OSHA on avian flu outbreaks, CDC guidance on flood response, and guidance from the USDA on animal carcass management. In addition to being exposed to infectious disease hazards, workers responding to infectious disease emergencies on farms may also be impacted psychologically by stress, trauma, and compassion fatigue. Stress can come from the human health impacts on the community, fear and anxiety about potential effects on personal health, and from loss of work and wages. Many workers will develop compassion fatigue if they spend time caring for sick animals or humans. Workers who are experiencing any of these psychological impacts will need psychological first aid, which includes supportive and practical help as well as referral to mental health services when necessary. The psychological first aid can be provided effectively by farm managers who know the workers and who can be trained to notice signs of psychological trauma. There are a number of resources available in the resource list in Module 5 that can help you learn about the impacts of infectious disease emergencies on the mental health of both farm workers and emergency responders and how to cope with it. In summary, planning is key to an effective emergency response. An effective response to an infectious disease emergency relies on having a well-designed and practiced emergency plan. You will need procedures for notification of and communication with government agencies in your plan, and a plan with special considerations for shared housing and transportation is needed to prevent transmission of COVID-19 between workers. The COVID-19 pandemic has been a prime example of a global infectious disease emergency. However, as we learn to live with this new disease in our communities, the pandemic is no longer an emergency situation at the farm level. You probably have some procedures in place at your farm to prevent the transmission of COVID-19 between workers. It is important to make sure that you also have procedures in your IPC plan detailing what you will do if there is an outbreak. Having thought through these issues before an outbreak occurs will help you to act quickly and consistently to any positive cases or to a widespread outbreak. You should have a sick leave policy in place that allows workers to take paid leave if they have any infectious disease, including COVID-19. Otherwise, there will be an incentive for them to come to work sick and spread it to others. You should also have a wage relief policy, or workers will be afraid to report illness for fear of losing income. If you have someone who tests positive, will you test the entire workforce or only those in close contact with the positive case? How will you determine who may have been exposed? What guidelines will you follow in determining when an employee who tests positive can return to work? Will a large outbreak lead to an inability to carry on your operations? If so, how will you manage that? The links on this slide, which are also listed in the resources section of Canvas, will take you to information about protecting workers in agriculture from COVID-19. No matter how much training you provide your employees on emergency response procedures, you will need to practice with hands-on exercises and drills in order for workers to really get a sense of what will be required of them in the event of an emergency. The more often you practice, the more familiar the workers will become with emergency procedures and the more comfortable they will be in their role in responding to an infectious disease emergency on your farm. And here is a list of additional resources that you can use in developing an emergency response plan for your farm. This concludes Module 5 of Infection Prevention and Control on Animal Farms.